Start recording. Now I'm off center again because I zoomed in. Lord, I swear. Where's my cane? I oughta get off my lawn! Nudge. Nudge. Is that better? Alright, hi and welcome and spastic eyes and scariness and stuff. So welcome back to my vlog. I am doing an update on my spinal diagnoses. I do not know the plural form of diagnosis. I've gone to the doctor a lot lately. A lot of you know that I nearly collapsed twice the week before Lent started. I was just making dinner and my knees buckled from under me, so that was 2 times too many for me. So I had a doctor's appointment on the 25th of February, and I went to my primary care doctor, and his paperwork is right here, and he diagnosed me with radiculopathy of the lumbar region, and he didn't really prescribe me anything other than a steroid pack, which I finished that week during my detox. The steroid pack helped a little bit with the inflammation issue, but I could not take my meloxicam because the next doctor I saw, like literally after I left my primary care's office, I went straight to the Ortho, and I saw him and got Xrays, and he diagnosed me with sacroiliac joint dysfunction, which is your S1, and spondylolisthesis of L5-S1. I already know that. That's a birth defect. My joint dysfunction of S1 is on both sides, left and right, and chronic bilateral lower back pain, unspecified sciatica. And he prescribed me pain meds, codeine, Tylenol with codeine, and I take that at night still, so I can't take that and the meloxicam together either. So I've not been on meloxicam for it's been a week and a half now, 2 weeks, week and a half, and I had a follow-up appointment on March 2nd with my primary care doctor. That's this paperwork. And I complained that my back was still hurting, but I didn't have the sharp shooting pain anymore. So they took off the radiculopathy diagnosis. They put it on, it's on my diagnosis chart still, but they said that basically it's not a pinched nerve pretty much anymore, and to do my follow-up with the ortho doctor. So this was, I get a thing in my email, and I'm going to show you this, and hopefully it shows up. So this is what I get in my email. I get an overall explanation of the visit. So the first ortho visit on the 25th of February, this is the notes from it, from the doctor. No acute distress, well nourished, well developed. It's talking about like my respiratory, my cardiovascular, my skin, just an overall how I look. Lumbar, paraspinal spasms, severity is severe. Lumbar tenderness to palpitation is also noted to moderate. Light touch sensation abnormalities, note of lower extremity, there is none. I have no issues with movement of my legs, range of hip motion, none of that. So I'm going to close that out. Save. And then the second notes that they gave me from the first visit, just an overall straightening of the right leg does not cause pain, left leg no pain, full range of motion there. The X-rays imaging that he ordered and they took, which I didn't get to see on the first visit, unfortunately. Let's see, Xrays taken on the 225, independently reviewed, minimal spondylolisthesis, minimal disc space narrowing, that's degenerative disc disease, L4, L5, L5S1, mild scoliosis, no other abnormalities, lumbar disc herniation with radiculopathy. So he validated my primary care's diagnosis. He said that I had a herniated disc as well, possibly at the L5S1, where I have the spondylolisthesis, which was causing the pinched nerve issue. And spondylolisthesis obviously was part of the problem. So the second doctor that I went to switched my meloxicam for something else and is putting me on muscle relaxers, prescribed Xanaflex and diclofenac, whatever that is. I've never been on that before. And a referral has been provided to me for physical therapy. The second ortho doctor that I followed up with on March 5th, Thursday, he said that due to my car accident that I had in 2016, he felt that I should have been on muscle relaxers this entire time, which I don't know if you can do extended time muscle relaxers, if that's even healthy for you. But he just flat out asked me, I was explaining to him, and he was like, well, when did all of this really start? And I said, well, I collapsed in 2008 at work from disc inflammation. I had a herniated disc, and it flared out really bad, and I couldn't walk for a while. And I pretty much stayed home with the kids ever since then. And then I got in a car accident in 2016, and that's when my issues really started. I've started getting more herniated discs, more pinched nerves. I mean, much more back pain. And he said that it's my muscles are spasming in the back. It's just like a domino effect of everything. The herniation and the arthritis and just everything. It's causing each other to flare up, kind of thing. And he wrote, was involved in motor vehicle accident back in 2016, subsequent onset occasional back pain, sometimes radiates to lower extremities with associated numbness. My left leg does go numb occasionally, or I get, like I said, the knees buckling issue if I have the sciatic pain. Her symptoms have been gradually worsening ever since. She did do PT for her neck after the incident. I had whiplash. I did PT for 2 months, I think. 2 months. It really didn't improve anything. My neck still crackles and stuff. I have cervical arthritis that got exacerbated by the accident. But not in the past 6 months. She was prescribed Medrol dose pack by PCP. Presented to OOC on 2/25. That was the first ortho doctor. When she was instructed to start the course of steroids, she had already been prescribed and was given a prescription for Tylenol with codeine. Today, she complains of belt-line lower back pain. She takes meloxicam and applies heat with some relief. I told him, on average, it's a 6 out of 10 every day as far as pain goes. He said that the meloxicam probably isn't strong enough for me, and other than the muscle relaxers he wants me on, he wanted to see if I could try something else for arthritis, which is the new prescription. That's the progress notes. For that, I read that to you in my last video from 2/25. All of these are just overviews, hip flexors, etc., etc. So I managed to get a copy of my new Xrays, and these are my new X-rays, and let me see if I can zoom in a little bit. Oh, that is mucho better. And I'm going to scroll down. As you can see, the scoliosis, my joints and stuff don't, all my vertebrae don't line up. All of these are compacted together. There's multiple vertebrae there. This is your S1, this area right here. So that's my back from standing up. I did a standing X-ray. He wants me to go do an MRI, but he wants me to do physical therapy for at least 6 weeks first, and then go do an MRI, and then he wants to see how my back is laying down. So this is standing up, and this is to the side. Let me zoom in on that. So I've got normal disc spacing there, and then you get down towards the base here, and you can see the spondylolisthesis, that it's sliding off. It's not lined up, it's sliding off, and the disc in between, there's like nothing there. And this is the L5, and this is the S1, I believe. And there's some disc wear and tear here, but he didn't mark that as degeneration there. This is the degeneration that he's marking here. And where this kind of leans back naturally here, and with this here pulling on the nerves that go through here, that's where I'm getting the flare up and the pinched nerve issue, and then all the shooting pain goes down through the legs. And then he did an X-ray where I'm leaning back a little. I don't understand the leaning back one, but I don't know how to make that any easier to see. Which shows that when I do move, it does slide a little bit further out, but it's not as bad. And this kind of pretty much closes up in here in this area. So if I put these side by side, I don't want that getting like extra huge. If I put these side by side, you can see the slight difference. Like this. And when I lean, if I lean forward or lean back, that affects how much space I have in this disc area. If it gets pushed down a lot, this gets pushed down a lot. This whole area just gets compacted. So that's causing my muscles to go out of whack and my nerves to be pinched and stuff like that. So it's beautiful, let me tell you. So I'm going to be on new meds. Muscle relaxers. I still have my pain meds until I run out of those, as needed, which is usually in the afternoon, but I'm going to go off of them to try my new arthritis meds and see if those work really well. I have to ask the pharmacist when I can take certain meds, because I'd like to be able to take the arthritis meds in the morning and then anything else later in the afternoon if they don't cancel each other out or cause any issues. So I basically just wanted to update you guys, show you the new X-rays and everything like that. This is my spine. It's a little crazy. Zoom out. Isn't that crazy? That's the bottom. So, I guess I would just keep you guys updated as much as possible on everything that's going on, and hopefully we get my back sorted out. I will let you guys know how physical therapy goes and how my MRI goes once I get that done. Right now I can't really do physical therapy. My car is starting to make a noise. It's not entirely acting up. It's just having issues with shifting, and I don't think it's exactly transmission. specific. I think it's probably needs desperately an oil change and a good tune up and stuff more than anything. So I will let you guys know when I'm able to get all that done. I'm supposed to go once or twice a week. So thank you all for your continued support on my channel. I really appreciate everything, all the advice and everybody's sympathies and private messages and stuff like that. I am really appreciative of it all. So please keep me in your thoughts, and I will keep you guys updated. All right, bye.
Tell me pretty lies, look me in the face, tell me that you love me, even if it's fake.